Carrie.
Hi.
I'm going to be your occupational therapist for today. How are you doing?
Pretty good.
Doing good?
Yeah.
Okay, so what we're going to do today is we're going to look, feel, and move some of your shoulder joints around just to see how well they're doing today. Okay, so what we want to look at first is we want to examine and see if there's any swelling, any redness around the shoulder joints. So we're going to look at the sternoclavicular joint. We'll look at the acromion-clavicular joint and the GH joint for any swelling or redness. If the GH joint is swollen, there will be an anterior portion of it, kind of looks more anterior, and you're going to compare it to the other shoulder just to see any differences. And we'll also look at muscle atrophy as well. We'll look at the deltoid muscles, and then we'll look at the infraspinatus muscle and supraspinatus and teres minor muscles as well. If there is atrophy of the deltoids, the shoulder will actually be more square than it is naturally curved. And also we want to look for any misalignment of the shoulders just by comparing them to each other. And also any winging of the shoulder blades. Okay, now we're going to feel some of your shoulder joints, and we're going to start from the medial aspect and go laterally. We'll begin by popping the sternum, going up towards the sternoclavicular joint, and so we're looking for any tenderness. We're going to follow the medial convex area of the clavicle towards the lateral concave aspect of the clavicle until we find the AC joint, where we also feel for any tenderness as well. Also below the lateral aspect of the clavicle, we will find the coracoid process, and again check for any tenderness. Lateral to that, we'll find the GH joint line, which is right here, and we'll palpate for any tenderness, and we'll go back up to the acromion, and we'll go medially and all the way laterally and posterior, checking for any tenderness. Below the acromion, there will be a subacromial bursa, and this can be palpated when the shoulder is extended because the bursa is moved anteriorly. So it can be palpated this way. Posterior to that, you will find the deltoid bursa. And back on the acromion, if the shoulder is externally rotated, you are able to feel the bicipital tendon coming through the bicipital groove. We will now populate down the humerus and then onto the spine of the scapula. And we're checking for any tenderness of the supraspinatus muscle, the infraspinatus muscle, teres minor, and the upper traps. When conducting the shoulder examination, it is important to also examine the axilla, and so you want to measure the medial aspect of the axilla, the lateral aspect, behind the pectoralis major, and also posteriorly. Thank you. Okay, now we will conduct a formal active range of motion test. So we are looking for the smoothness and extent of the movements. Okay, Ms. Cryer, can you abduct your arms to the sky for me? Bring your arms behind your head and push your elbows back. Bring your arms back above your head and turn your palms out. Drop your arms down to the side slowly. With your left arm, touch your right shoulder. Go ahead and relax. With your right arm, touch your left shoulder. Can you flex your shoulders up above your head in front of you? Now bring them down. Now bring your arms behind you. Take them back to your sides. Reach behind your back as if you were scratching your back as high as you can. And now scratch with your other arm. Do a push-up on the wall. At this time, we are looking for any winging of the scapula. If winging is noticed, it may be secondary to lateral scapular nerve damage. Okay, now turn around and face me. We're going to check internal and external rotation now. So I want you to place your elbows at a 90-degree angle like this, and can you externally rotate them, bringing them outwards? Now go ahead and bring them inwards toward the body as if you were giving yourself a hug. Okay, thank you. Next, we're going to do 3 different examinations to test for shoulder impingement. On the first test, we will hold the acromion down and we will passively abduct the shoulder. Do you feel any pain there?
No.
No? Okay. The second test is the near test. So we will flex the shoulder. So bring your arm up and internally rotate. Do you feel any pain there?
No.
Okay, and we're going to go back down. And the last test is the Hawkins test. We will flex the shoulder to 90 degrees, flex the elbow, adduct the shoulder, and internally rotate. You feel any pain there?
Nope.
Okay. Thank you. Okay, next we're going to do a few formal tests to examine the rotator cuff muscles. Can I get you to flex your elbows to 90 degrees? And go ahead and abduct your shoulders, so bring them out like that. Now hold this position and don't let me move you. Okay, go ahead and relax. Can I get you to bring your arms out in front of you? The next test is called the empty can test. So you're going to pretend like you're emptying out this bottle for me. Okay, and I want you to hold it there and don't let me push you out. Okay, good. Go ahead and relax. On this next test, can I get you to bring your arms back here and keep your elbows tucked in at your side? Now bring your hands outward, and I'm going to try and push you inward. Hold it there. Don't let me move you. Okay, good. Go ahead and relax. This next one, pretend like you're hugging yourself, and I'm going to try and pull you outward. Okay, hold it there. Don't let me move you. Okay, good job. Can you turn around and face the back wall for me? Reach down behind you like you're tucking in your shirt. Keep your hand away from your body. I'm going to try and push your hand towards your body, and don't let me move you. Okay, go ahead and relax. And thank you.
Thank you.
Okay, this next test that we're going to do is called the Jurgensen's test. And first I want you, can you put your arms to the side like this with your palms up? I'm going to try to turn your hand over, and I don't want you, don't let me move you, okay? Okay, good. Okay, now I want you to put your arms out in front of you like this with your palms up, and I want you to hold it there. Don't let me move you. Okay, good. Go ahead and relax. Okay, next we're going to examine your acromioclavicular joint. So I want you to reach across your chest to your opposite shoulder. Okay, and I'm going to apply some pressure and let me know if it hurts. Does it hurt?
No.
Okay. And now I want you to, can you reach behind your back? And I'm going to apply some pressure. Let me know if you feel any pain.
Nope.
Okay. And next we're going to measure your glenohumeral joint stability. So if I can have you turn that way for me. Okay, so we're going to check your anterior stability, posterior stability, and inferior stability. Okay, and the next test I want you to is the apprehension test. So I want you to move your arm out to the side of you just like that, and then bring your elbow in just like that, and I'm going to externally rotate you. Okay, good, and go ahead and relax. Okay, now we're going to examine your myotomes. So can I get you to hold a position like you're at a bar waiting for customers? Okay, and let me know if you feel any pain when you're in that position.
Nope.
Okay, now can you hold your hand out like you're carrying a tray of drinks? You feel any pain?
Nope.
Nope. Okay. And now I want you to ask for a tip. So just like that.
Mm-hmm.
Okay, and your customers didn't give you enough money, so you say, give me more. Okay, and he says how much, and you tell him $5. Okay, good, thank you. Okay, lastly, we're going to check the dermatomes in your arm. So the first one we're going to look for is C5, and it's on the lateral aspect of your arm. We're going to look at C6, which is at the tip of your thumb, C7 at the long finger, middle finger, and C8 at your pinky, and then lastly T1, which is on the medial side of your arm. Okay, thank you very much.
Thank you.